Hello everyone, today we are going to study DiGeorge syndrome. Now imagine this beautiful baby, he presents to you in your OPD and the mother tells you that the baby turns blue whenever she is breastfeeding and the bluish discoloration or the cyanosis in our language resolves on squirting. This particular phenomena it's called cyanotic spell. Now this is something which is going to tell you that the baby is having some cardiac defects. Okay, I will explain it to you later. On examination you also found cleft lip and a decrease in the calcium concentration. Okay, thymic aplasia is present and you see the baby, right? This is somehow abnormal facies is present. This is the typical presentation of DiGeorge syndrome. Okay, these 5 points you need to remember. Now let me explain it to you. Number one is the cardiac defect. Now I told you the baby is getting blue whenever the breastfeeding is taking place and it resolves on squatting. Okay, now why this is happening, let me explain. This particular phenomena is called cyanotic spell. What happens that because of any reason, if there is sudden right ventricular obstruction, this results into increase in the right ventricle to left ventricle shunting. Now imagine the blood is going from the right ventricle to the lungs and then to the left ventricle. Now for any reason, if right ventricle and left ventricle shunting is taking place, the blood flow is going to be from right side to the left side and the blood flow to the lung it's going to decrease, right? So decrease in the pulmonary blood flow results in decrease in the oxygenation and as a result cyanosis take place. Now why, you must ask that why it resolves on squatting, right? So it is because of the compression of the femoral artery and as a result there is increase in the afterload and the shunting from the right side to the left side it decreases, right? So I have explained you this phenomenon. Now let me tell you the main thing of the DiGeorge syndrome. What is this? Why this happened? So it is a genetic disorder. It happens because of the deletion of the chromosome number 22. It is an autosomal dominant disorder, and this chromosome number 22 it's important for the normal development of thymus and the parathyroid gland. Now as there is deletion, the abnormal development is taking place the third and fourth pharyngeal pouch. As a result the thymus and parathyroid gland, and as a result the aplasia is going to take place. Now I told you, right, the calcium level has decreased. Okay, in this particular case the calcium level was decreased, so it could be because of the parathyroid gland aplasia, right? So you are going to think like that. Now abnormal facies, it is something you need to remember. Now see, just look at this beautiful baby, but now look from the eyes of a physician as a doctor. Look at the small jaw, right? See, see the small jaw of the baby, the small mouth and the downward presenting mouth, the low set ears, the downward projecting eyes of the baby, right? So these all are somehow the features of DiGeorge syndrome and the abnormal facies of this particular case. That's it. Thank you so much.